Hello, I'm Salomine Theron. I'm one of the radiologists at SCP Radiology.
Hello, I'm Andrea. I'm the lead MRI radiographer at SCP Radiology.
Children often get referred for an MRI when they have epilepsy. Certain epilepsy syndromes are known to have underlying structural abnormalities, and in those cases we want to pick that up. Occasionally, especially when epilepsy has a change in frequency, or whether sometimes the patients now experience more severe and longer lasting convulsions, they also need extra imaging to make sure there's no structural abnormality. And occasionally we'll also be asked to do an MRI after a first convulsion. So many MRs that we will do for epilepsy will actually be normal. So that means the focus that causes the epilepsy is too small to be able to see it on an MRI scan. What we want to exclude are those syndromes or cases of epilepsy or convulsion that are being caused by a structural abnormality in the brain, so a focal area where the brain is not normal, or by a lesion in the brain, which could be a little vascular lesion or sometimes a small tumor. In most cases, these tumors are good-natured, so they're benign tumors, but they can cause an epilepsy syndrome. And in those cases, if these tumors or vascular lesions are treated, so surgically excised, the epilepsy can be much better controlled.
MRI stands for magnetic resonance imaging. With these type of scans, we use superconductive magnets and radiofrequency signals to create images of the inside of a human's body. So for this reason, we screen the patients to ensure that no metal goes into the machine. It is important to inform the radiographer prior to making a booking for an MRI scan about these devices so that we can phone the medical technologist and make sure that your implanted device will be safe or not to enter the MRI machine. When arriving for an MRI scan, the radiographer will meet you and go through a MRI safe questionnaire and dress in a SCP MRI safe gown. We take extra care when scanning children because the process can be quite daunting for such a little human. Some of these conditions might include light sedation, full anesthesia. We do allow parents to be present while scanning a child because the comforting presence might help ease the child. Because of the loud noises of the MRI scan, we will make sure that you are fitted with earplugs as well as earphones to ensure that the noise of the machine doesn't injure your ears. We will also give you a panic button, which you can press at any time to let us know if there is anything that is bothering you. Once you are positioned, the radiographer will push you into the tunnel, step outside and conduct the rest of the scan from the outside. It is important to note that we will communicate with you from the outside via the earphones.